Welcome to the Health Channel, All Health All the Time. I'm Olga Villaverde coming to you from the Baptist Health South Florida studios. Did you know that our blood vessels transport about 7,000 liters of blood every single day? The veins in our legs carry blood from our lower extremities against gravity, that's amazing, towards our hearts. But what happens when these veins are damaged? Well, that's what doctors are calling a venous disorder. And here discussing venous disorders and overall vein health is Dr. Edgar Galinanes, vascular and general surgeon at Miami Cardiac and Vascular Institute. Welcome, doctor.
Good morning, Olga. How are you doing this
I'm
morning?
doing fantastic, and you?
Good, good. Perfect.
Thank you so much for being first time on the Health Channel, right?
Yes, thank you for having me.
Oh, no, we're honored to have you. I know you all are busy, and we do appreciate any bit of time you can give us to educate us. So speaking of education, before we dive into today's topic, let's do a little bit of personal education on you.
Okay.
Tell me your role on as a vascular surgeon.
Well, I am a vascular surgeon, so I'm trained foremost in the arteries and veins, everything, in any aspect of any type of vessel inside the body, outside of the heart or brain. I personally have been practicing for over 12 years vascular surgery here in South Florida.
12 years? I must say you look very young.
Yes.
You get that a lot?
I look younger than what I am.
Well, you look very young and you're very handsome. So moving on, let's do a little bit now on education, because a lot of people think, you know, arteries, veins, capillaries, we hear that. So give us a little bit of the anatomy 101 of what each one does and the importance of each one. I remember in med school, it was arteries away, the A was for away, yes, and the veins to the heart.
Yes.
There's my memory right there.
You did it, you know, you're absolutely right, and you actually alluded it in the very beginning. Arteries have the job of taking blood from the heart, you know, think about it, down to your feet, away from the heart. While veins have the opposite. They have to bring it back, and they actually have a harder job because they have to go against gravity.
Right, and that's amazing.
Correct, and that's where all the problems come in.
And why is it then that problems are more so in the veins than the arteries? Because of that extra effort it needs to go back up?
Correct. They actually have to go against gravity, and to aid them, there's these valves that open and close, as opposed to the arteries. They don't have these valves. Okay,
and capillaries?
Capillaries are in between. They connect both the arteries and veins, and they really help kind of manage everything.
Okay, so when we have issues in our let's say veins or arteries and capillaries, do you see them more in the veins than the capillaries? Because I don't hear much about the capillaries.
Correct. If you're having an issue with the capillaries, it's going to be more of a the best word to say, intrinsic, more of an underlying issue, as opposed to the veins, where it can just be a factor of just gravity itself over time.
Okay, so let's dive into some of the different types of vein diseases. According to the National Institutes of Health, vein disease affects more than 25 million Americans in the United States. Now, that's quite a large number. And any reasons why? Is it smoking? What would you say are the reasons why?
Well, you know what? Vein disease is actually one of the oldest diseases that has been plaguing mankind. It actually was first described in ancient Greece. You know, back then, Hippocrates described it in the soldiers, because they'd been standing for such long periods of time. Oh. If you remember, the soldiers back then were adolescents.
That's right.
And they just standing for long periods of time causes that force of gravity to pull that weight of the blood down, and that overcomes the valves and causes what's called venous insufficiency, or essentially venous hypertension.
Isn't the Hippocratic Oath from Socrates?
Yes.
As well? Yeah, all these little things that are coming back to me. All right, we're going to take a look at some of the venous diseases that are usually diagnosed. Doctor, walk us through some of these. Chronic venous insufficiency, what is that?
Chronic venous insufficiency, that's when the blood is not going in the right path. As I had alluded to before, blood should be coming from the veins, from the feet up down to the heart. When you have venous insufficiency, it's going the wrong way.
Okay, the next one?
Deep venous thrombosis, and where you actually have a formation of a clot inside the vein, preventing flow through that vein.
And that could be very dangerous, right?
That can be very dangerous.
We hear that as DVT.
Exactly, that's a deep vein thrombosis, and that's a variant of thrombosis. And the risk of that is that it can go to your lungs.
Excessive blood clotting?
Excessive blood clotting is when you have an underlying genetic predisposition, genetic reason for clotting or forming these clots. And a superficial venous thrombosis is a variant of deep vein thrombosis that's very painful, but not as serious as deep vein thrombosis, as the risk of what we would call pulmonary embolism, a blood clot traveling to your lungs, is very low with superficial venous thrombosis. And then we have the least serious, the varicose veins and the spider veins, which can be quite a nuisance, and but more typically they're a sign that there may be something underlying.
Okay, so it's not just that beauty thing that's bothering the woman, because obviously, you see it sometimes and you don't like it, and it's easy to fix, but there could be more to it.
Correct. Think about it in an iceberg. It's just the tip, and there may be something deeper underneath.
Great analogy, love that. Okay, so what causes venous diseases? We have a graphic here of some risk factors. Heredity?
Correct. So many patients have a genetic predisposition. So I often hear that, oh, my mom had veins, my grandmother had veins, I have veins. And very much the patient's absolutely correct. It will carry it down with it. Pregnancy is another very common reason for venous disease, and usually we find it in, obviously, in women. And then age, as you get older, remember I told you that standing for long periods of time causes vein problems. And as you can only expect, after a certain amount of years in life, that can cause predispose you to venous problems. And then gender itself, which falls on the line with pregnancy.
More common with women, right?
Of course.
All right, there's also obesity, lack of exercise, and long periods of standing, which I've
alluded to before, but also long periods of sitting. How often nowadays do we travel on a plane and the magazine in front of you talks to you about vein disease? So it's just not just standing, but sitting for long periods of time, and we're starting to see that also as in the 21st century, as our culture transforms to more of a sedentary position, especially in Silicon Valley and so forth. You have many people sitting in cubicles, and they took the screen away.
All right, let's take a look at, let's say it's a leg with some varicose veins. So let's take this image, and doctor, if you could tell us what we're looking at here. And this doesn't look as bad. I mean, I used to work with my dad in his office. He's a vascular surgeon as well, like you, doctor. And I would see some images that were really, really bad. But tell us what we're looking at, and how bad is this one in your opinion?
So right here, you're starting to see the varicose veins. You can see the clear tortuosity of the veins, and as they pocket out. And here they actually become quite part of the skin. This is not too bad. This is what we would classify most likely as a class 2, 1 to 6, 6 being the worst, 1 being the least. So this is just the beginning of something deeper underneath.
And are there different stages? I mean, does it take a while for this to occur over time?
Yes, this is a chronic disease that goes on for years. And here you can kind of see what I kind of alluded to, that this is a deeper problem underneath. You can see here the vein, right, the tortuosity of the varicose vein, but you can see how it's connected to the deeper veins underneath.
Okay, and another question that I have is, why is it so common in the legs? I know you talked about the standing or maybe the sitting or the lack of exercise, but why don't we see them like in the arms when we're sitting, or standing?
Correct. More common in the legs because that's where the most of the effect of gravity actually occurs. Basic physics, if you have a column of fluid, the pressure is always greatest at the bottom.
Okay, and are there symptoms for people when they have these varicose veins, doctor, or is it just, again, just don't like to see them, or is there some discomfort?
Everybody's different. Typically, it's very variant per the patient. Some patients just have the varicose vein and they don't like the aesthetic or cosmetic appearance. Other patients have a lot of significant pain. So I have patients who come in with painful varicose veins. All
right, and before we bring you back to the desk, what are we looking at there over your shoulder, doctor?
Here you're obviously seeing a more in-depth look at that varicose vein. You can see the tortuosity again. And again, this is what I alluded to. Here you can see the valves. These valves are one-way set of valves. So every time, think about it, every time you take a step, the muscles contract, that pushes the blood up past these valves. And the valves stay at this position, they close on themselves, preventing the blood from falling back down. When you take another step, it goes to the next set of valves, all right? Anywhere from your ankle up to your hip, you can have anywhere from 8 to 10 set of valves, all right? And in this picture, you're clearly seeing the dysfunction of the valve, which prompts the blood to fall all the way back down to your feet, causing increased pressure inside the venous system.
All right, great. Thank you for that information. All right, doctor, join me back here because we have a photo now of some of those stages that we were talking about. And let's take that and show our viewers. Doctor, let's talk about these. Obviously, the left being a normal picture of a leg with normal veins. And then through the progression of time, let's talk about what's happening through stage 1 through stage 4.
There you see in stage 1, you start to see the development of reticular veins and spider veins. Stage 2, you start seeing the development of varicose veins or venous nodules, typically defined as a vein greater than 3 millimeters in dimension.
These are pretty serious.
Correct. And then by this time, the patient's obviously acknowledging them. And sometimes, often the patient comes in with complaints of they're painful or they're bleeding spontaneously.
Ooh.
Stage 3, you start seeing lower extremity swelling. Well, that's what edema means. And then stage 4 is when you start to actually see the extent or the worst portion of the disease, where you start to see hyperpigmentation, so that's discoloration of the skin, and that's actually what we call hemosiderin deposits. So if you think about it, when you breathe in air, our lungs extract the oxygen. The oxygen actually has to transport, the blood has to transport the oxygen to the rest of the body. It does so bound to iron. So when you get the blood pooling, you have that iron deposits sitting in that skin, and that's where you get the discoloration. With time, that can cause ulcerations. Now, we're not talking about a period of 1 to 2 days or months or years. We're talking about over 20, 30 years.
All right, but looking at that stage 4, that looked pretty painful.
Yes.
How do you treat that?
So the typical treatment with that is compression therapy. And 90% will resolve.
And what would that be, compression therapy?
Compression therapy can consist anywhere from compression stockings to an actual wrap. Typically, if the patient has progressed to a wound, an ulcer, I prefer to place the patient in a wrap.
Okay, I've heard of endovenous ablation. What is that, doctor?
Endovenous ablation is when you're treating the underlying venous insufficiency. Remember I talked to you about the valves and how the valves fail, causing the accumulation of blood. You think about our circulation as a system of high to low pressure, and our veins being the low pressure and our arteries being the high pressure. Once the blood pools in the veins, that actually causes increased pressure in the venous system. So, we often refer to, I have high blood pressure, but we're refer to arteries. So when you have a venous problem, you often have high blood pressure in your veins. All right, and what the radiofrequency ablation does, it reroutes the veins and fixes that high blood pressure in your veins, which is the underlying problem to varicose veins. And
is there ever a situation where you surgically remove the veins?
Yes.
You can?
Yes.
Wow.
Back in the day, and I guess, 20 years ago, even before then, they used to do what was called vein stripping, where they would actually remove the whole vein in your leg. Unfortunately, that was plagued with lots of complications. Patients would develop postoperative swelling and pain. You can imagine there's lots of other things that run with the vein, such as nerves and lymphatics. So what we do now a day is we actually use a combination of radiofrequency ablation, and we do what's called micro-stab phlebectomies, where we take out those small pesky varicose veins that don't go away with our other treatments.
And what about then those little pesky veins that you're taking away that were supposed to return blood back to the heart? Now you're just making the other ones work harder?
So you have more than one vein in your leg.
Obviously.
You have multiple veins, so many that doctors, we really don't like to name every single one of them. We'd be there all day. So what we do is we divide them in two groups. You have superficial veins, the veins that you can see in the skin, they run through the fat, and then you have deep veins that run through the muscles. These are the veins that we can't see. Typically, the veins that run into the muscles are supported by the muscles. Okay. The muscles almost act like compression stockings. Those rarely fail. Unfortunately, the veins that run through the fat, they have no support. So those are the veins that most often fail in these circumstances, and by closing the superficial veins, we reroute the blood to go up the deep system.
Great stuff. I didn't know that. Thank you so much. All right, we're going to take a quick break, but when we come back, we mentioned blood clots, and by the way, it's another type of venous disorder that affects as many as 900,000 Americans each year. We're going to talk about understanding the difference between blood clots and DVT when we come back. You're watching the Health Channel, all health all the time on South Florida PBS. If you have a question for the doctor, please call us using the toll-free number right there, 855-796-4475. You can also visit our website, It is fantastic, allhealthtv.com. You can watch a live stream of the Health Channel, and you can watch videos from previous episodes. We're back in 2.
Hi, I'm Luis Fonsi, and I'm here at the Miami Health Channel studios with the Thanksgiving campaign from St. Jude Children's Research Hospital. I hope you can become involved, and I hope you can donate to save lives. To do so, please visit stjude.org. Happy holidays.
A brain aneurysm doesn't care that you have important meetings. It doesn't care that you have to drop your daughter off at ballet and your son off at soccer practice. So if you suddenly experience the worst headache of your life, sharp pain behind your eye, and blurry vision, seek immediate emergency care. The Lisa Calagrassi Foundation, shedding light on brain aneurysms. Learn more at lisafoundation.org.
You have heard about breast cancer, but do you know BRCA? BRCA stands for Breast Cancer Susceptibility Gene. Everyone has BRCA genes, but some women inherit BRCA genes that have a mutation or a change. Women with this genetic change have a greater chance of developing breast and ovarian cancer than other women. About 50 out of 100 women with a BRCA1 or BRCA2 genetic change will get breast cancer by the age of 70. CDC offers a confidential web tool called Know BRCA that women can use to learn their risk of having a BRCA gene mutation.
Learning your risk for a BRCA gene mutation allows you and your doctor to make important decisions for your health. This may include genetic counseling and testing, enhanced screening, and other methods to reduce your risk of ever developing breast or ovarian cancer.
Enter your family history, learn your risk, talk to your doctor. Visit knowbrca.org to find out more.
C stands for cutting-edge research, clinical trials, and collaboration. Creating breakthrough treatments as Florida's only member of the Memorial Sloan Kettering Cancer Alliance. At Miami Cancer Institute, C also stands for Cure, world-class cancer care right here at home. Learn more at miamicancerinstitute.com.
Welcome back to the Health Channel, All Health All the Time. I'm Olga Villaverde, and with us is Dr. Edgar Galinanes, vascular and general surgeon at Miami Cardiac and Vascular Institute. If you have a question for Dr. Galiñanes, please call us using the toll-free number 855-796-4475. We would love to hear from you. All right, so blood clots. We mentioned that it affects as many as 900,000 Americans every year. And here's the thing, they don't discriminate and can affect anyone. So doctor, you're now at our 3D monitor wall, and I believe we are looking at a blood clot. Tell me what's happening here.
So right here you can clearly see the vein, and it's actually been, the top of the vein has been stripped, so you can actually see the inside. And here you can see the blood passing through, and here on the sides, the valves that I had talked about earlier. And here you can see an accumulation of all those all those red blood cells, and that's what causes a clot. Now, there's a phenomenon in medicine that we call Virchow's triad, where you actually have 3 reasons to form a blood clot. So, an injury, an injury prompts some reason for some reason for hypercoagulability. That means a reason to form a blood clot, and then stasis, being immobile for long periods of time. And when you have these 3, that forms the blood clot.
And how dangerous is that blood clot there? I mean,
now,
I've heard stories of people that have passed because the blood clot was there and they didn't have enough time to get to the hospital.
This blood clot is extremely dangerous. At this point, this blood clot is in the leg. As long as it stays in the leg, it's just a nuisance. The risk is that this blood clot travels up to the lungs, becoming what's called a pulmonary embolism, and that can be fatal.
Okay. And how do you fix that, doctor, real quick?
The first line therapy for this is obviously seek medical attention and systemic anticoagulation.
Okay, and that means for our
blood
viewers?
thinners.
One more time?
Blood thinners,
Blood thinners.
medicine.
Like Coumadin.
Yes, like Coumadin.
Very good. All right. So in March of 2015, the CDC and the National Blood Clot Alliance launched a national awareness campaign called Stop the Clot. Spread the word to increase general awareness of a blood clot. Let's take a look at this video highlighting the signs and symptoms of blood clots and the factors that can increase the risk for them. Take a look.
If you think that a blood clot can't happen to you, think again. Blood clots affect everyone, from infants and young children to teens, young moms and dads, people of middle age, and senior citizens too. People from all walks of life are affected by blood clots. A blood clot can happen to you. Up to 900,000 people are affected by blood clots each year. About 100,000 of these people will die. Some experts say that the number of deaths due to blood clots is greater than the number of deaths due to AIDS, breast cancer, and car accidents combined. Think about this. On average, one person dies every 6 minutes due to a blood clot. Don't let that one person be you or someone you know. Blood clots can be prevented. Stop the clot. Learn about your specific risk factors for potentially life-threatening blood clots. Blood clots occur most often in the legs, but can also occur in your arm. A blood clot in your leg or arm can move or break apart and travel to your lungs, which can be deadly. There are so many people at risk for blood clots because there are lots of different risk factors. Hospitalization for illness or surgery, particularly surgery of the pelvis, stomach, hip, or knee, is one of the leading risk factors for blood clots. Trauma, particularly if veins are injured due to broken bones or severe muscle injury, can cause blood clots. Cancer and some types of cancer treatment can cause blood clots. Birth control methods that contain estrogen, including the birth control pill, the patch, and the ring, are risk factors because increased levels of estrogen can cause blood clots. Similarly, hormone replacement therapy used by women undergoing menopause can pose a blood clot risk. Pregnancy can place some women at risk for blood clots, even up to 6 weeks after the baby is born. Up to 8% of people in the U.S. are estimated to have one of several genetic risk factors that can increase the risk for blood clots. So, your family history is important to know too. Being overweight, leading an inactive lifestyle, sitting too long, or being confined to bed too long can increase your risk for blood clots. The first and best step to prevent blood clots is to know your risks and discuss them with your doctor or healthcare provider. Next, you need to be able to recognize blood clot symptoms. The signs or symptoms of a blood clot in your leg or arm can include swelling of your leg or arm, pain or tenderness that you know is not caused by an injury, and the skin may be warm to the touch and red or discolored. If you experience any of these symptoms, talk to your doctor or healthcare provider as soon as you can. The signs or symptoms of a blood clot in your lung could include difficulty breathing, chest pain that will worsen when you take a deep breath, coughing or coughing up blood, and a faster than normal or irregular heartbeat. Seek immediate medical attention if you experience any of these symptoms. Blood clots can be prevented, so make sure to review your risk factors with your doctor, particularly if you'll be having surgery. Let your doctor know right away if you experience any of the signs or symptoms of a blood clot. There are medications that can help reduce your risk or treat blood clots safely. So discuss your treatment options with your doctor if you're at risk or if you do experience a blood clot. Talk to your relatives and find out if they know about a history of blood clots in your family. Let people in your family know if you learn that you or others in your family experienced a blood clot. Spread the word. Tell your friends how important it is to understand their blood clot risks.
And we were just talking about how many thousands of people are walking through the streets of, South Florida and don't even know they have a blood clot.
That's correct.
Important to drink water?
Water is the number one thing that I recommend in all my patients. Water is a natural blood thinner, organic, and remember, I talked about the 3 things that causes a blood clot, and one of them is the hypercoagulability, and dehydration can definitely cause that.
How long do they take to form?
They can be instantaneous, but they can take anywhere from just a few hours to a few days to even I've seen patients that come in after a week.
Wow, and how many different types of blood clots are there?
Well, there's just one, just a blood clot, and then the problem is when that blood clot, that deep vein thrombosis, travels and becomes a pulmonary embolism.
That's when it's really dangerous.
Correct. Now there's one that we talked about earlier in the segment, was a superficial venous thrombosis. That's where one of those veins, remember I was telling you about those veins that are different, superficial and deep? That's when one of those superficial veins, the ones that occur in the fat,
go into the muscle?
No, the ones that go into the fat gets thrombosed, and that can be quite painful.
Oh, okay. Thank you. All right, so we actually have another clip of some treatment options, including some from your colleagues at the Miami Cardiac and Vascular Institute. So let's watch this real quick.
And basically we would put this in between the, inside the blood vessel, and by inflating the balloon, this would cause the plaque to expand and to actually get crushed and pushed inside the wall of the blood vessel. So this opens up the flow channel and allows blood to flow back through the blood vessel.
Okay, so we've looked at a balloon, and I know you have some other items with you. You just picked one up, so
this is a stent.
Okay.
If the balloon is not successful at keeping the blood vessel open, the next step would be to place a stent. The stent is a little metal cage that is self-expanding in this particular stent. Excuse me. And this allows the blood to flow through the stent. If that is in certain situations, we have to place a covered stent, which is what I'm showing here.
Okay.
And in this covered stent, this is the similar material to what the bare metal stent is, but this has a covering on the outside of it that would allow the blood to flow through aneurysms and other things.
Wow. Okay.
And I'd say for most of the complex lesions we treat these days, we end up using stents more than anything else, and the newer stents have drugs on them that come off the stent and get incorporated into the vessel wall to help prevent the plaque from coming back. Because a big problem with all our treatments is we're not curing the atherosclerosis, we're treating symptoms. So those symptoms can come back if the plaque comes back. So our big focus of research really is how to prevent that plaque from coming back once we treat a patient.
All right, doctor, can you expand on that a little bit, and when would these treatments be necessary?
Of course. So what you saw right now was Dr. Galinanes and Dr. Shiro discussing different types of modalities that we use in patients in peripheral vascular disease, which also includes peripheral artery disease. Now, there are some situations where a patient, let's say, has a blood clot in their leg, and we would intervene. Most likely in those cases, we would offer them what would be called a percutaneous mechanical thrombectomy. That's where we go in and we actually physically remove the clot using a special catheter. And there's different methods we can do that. We can do it with a hydrodissection. One is where we actually use some water and we break it down. And the other one's actually a big catheter that's connected to a suction, and we actually suck it out its entirety. Other options too is where we actually put a catheter in there and we leave the catheter in the patient overnight.
Really?
And we actually drop what clot-busting medication.
Clot-busting medication.
That's correct. And we leave the patient there overnight, we bring them back, and the clot is gone.
And it's gone.
Now, there's obviously some unique instances where the patient forms a clot secondary to maybe a mechanical compression, maybe a little bit higher up. You know, the way our bodies are made, our artery runs on our left side and our vein runs on our right. So right at your belly button, they split into two. So the artery for your right leg actually runs over the vein for your left leg. All right, so you have some type of physiological compression, and that's normal. That's normal. But in some circumstances, it can be a little bit more for one person than the other, and they can form a blood clot on the left leg. Okay, and that's also why most people realize when they come in to see me, hey, I get more swelling in my left. Or, did you know it's more common to have blood clots on your left leg than your right?
Oh, look at that.
For that anatomical reason. So if you're one of these unfortunate patients who has a blood clot and you have some mechanical compression, that's when you would see one of these stents that Dr. Shiro had shown. That's the reason why we would place one of those, to make sure that that vein stays open as that artery goes over.
Great stuff. Thank you so much, doctor. All right, we're going to take a quick break, and coming up, varicose veins, blood clots, DVT. This could all lead to venous insufficiency. What is that? Well, that's when your veins have trouble sending blood from your limbs back to the heart. Remember, against gravity. We're going to talk about it in detail when we return. You're watching the Health Channel, All Health All the Time on South Florida PBS. If you have a question for Dr. Galinanes, please call us using the toll-free number 855-796-4475. And please be sure to visit our website, allhealthtv.com, where you can watch a live stream of the show and watch videos from previous episodes. We're back in 2.
C stands for courage, collaboration, compassion, and sometimes even cuddly. At Miami Cancer Institute, C also stands for Cure, world-class cancer care right here at home. Learn more at miamicancerinstitute.com.
Hi, this is Terry Bradshaw here to remind you that rheumatic diseases like rheumatoid arthritis and lupus are important to know about. 1 in 4 Americans has a rheumatic disease, and I'm one of them. And if you're like me, folks, you don't have time for arthritis to slow you down. Between being a sportscaster, making movies, and checking things off my honey-do list, I'm busier now than I've ever been. Flare-ups aren't fun, which is why I follow the orders of my rheumatologist. Eating healthy, staying active, not smoking, taking my meds, and managing my stress all keep me going. I've also committed to my health by taking the American College of Rheumatology's pledge to live well with rheumatic disease, and you should too. Know the signs, get help, and take care of yourself, folks. Visit simpletask.org to take the pledge to live well.
Everyone deserves a decent place to live.
Everyone.
When a future homeowner partners with Habitat for Humanity to build or improve a home, they build a better future for themselves and their families.
For my family.
For my family.
For my family.
With a little help, we all have the potential to stand on our own.
Potential. Potential.
Potential.
Visit Habitat.org to provide help to families like these today.
Welcome back to the Health Channel, All Health All the Time. I'm Olga Villaverde, and with us is Dr. Edgar Galinanes, vascular and general surgeon at Miami Cardiac and Vascular Institute. If you have a question for the doctor, please call us using the toll-free number right there, 855-796-4475. We would love to hear from you. So this hour, we've discussed a number of venous disorders, varicose veins, blood clots, DVT, but let's talk about venous insufficiency, because everything we've discussed so far can actually cause venous insufficiency. Is that right?
That's correct. That's correct. So, blood clots themselves can cause venous insufficiency, and a patient that has a blood clot develops what's actually called post-thrombotic syndrome. It's a fancy way of just saying the blood clot destroyed the valves, and now you have high blood pressure in your veins, which is venous insufficiency. Other reasons that we alluded to earlier in the show: genetic predisposition, standing long periods of time, pregnancy, and the risks, go on and on. And unfortunately, this is kind of the underlying medical issue when we talk about patients with varicose veins or even these spider veins.
You mentioned some of those risk factors. Let's show our viewers. We have a couple of pages of them. So number one on that list would be blood clots.
Correct.
Which you talked about, varicose veins.
Varicose veins. Most commonly, it's a sign that there may be something more underlying. Obesity, absolutely. Obesity, that increased intra-abdominal pressure puts more pressure on those veins, making it harder for the veins to return the blood up. Pregnancy and smoking, absolutely. Smoking is a risk factor for all cardiovascular diseases.
Cancer as well?
Cancer as well. You actually are more prone to forming blood clots, DVTs, with cancer. Muscle weakness. Unfortunately, with patients with muscle weakness, they're not as mobile. They're not as ambulatory as we would like. They can't get around as much, so that kind of just laying around causes them to have blood clots. Swelling of superficial veins. Family history is a very strong risk factor, and sitting or standing for long periods of time.
Is it painful, venous insufficiency?
Venous insufficiency itself is not painful. Typically what patients come in with is feeling of fatigue. At the end of the day, they're extremely tired and they don't know why.
Okay, but that can happen to everyone.
That can happen to everyone.
That happens to me by 5 o'clock.
It can happen to everyone, and I see very commonly in younger patients. They come to me, "Doc, I don't know what's going on. I feel tired. My legs feel really heavy. I feel like I'm carrying around bags of water. What's going on?" And they have horrible underlying insufficiency. And remarkably, after we treat them, their venous insufficiency, the patients have new life. They feel better. They can get around. They can go back to doing their activities.
How do you go about diagnosing it?
So a clinical exam is the first and foremost. We take a look at the patient's legs, we examine, we do a cardiovascular exam, but the next step would be what we call a duplex sonography, where we actually do an ultrasound looking at the veins. Now this is a little different from an ultrasound just looking for a blood clot. We actually have the patient stand up and we compress the veins, and we actually measure the velocity with which the blood goes up and down past these valves.
Oh, and that is telling you then?
If there's any insufficiency present, if the valves are working.
All right, and if you see that they're not, then immediately you have to do what?
Immediately, the first line treatment, if you're diagnosed with venous insufficiency, the first line therapy should be compression stockings.
Okay, I think we have a picture of compression stockings, so we could talk about that a little bit. Are there different types? Are there different strains, for example, doctor? How does compression stocking work? Here they are right here.
Correct. So they're all different types. Back in the day, there was only just one type, but now in the 21st century, a whole bunch of companies have come out with a whole bunch of different variations, from knee highs to thigh highs, ones that have Velcro, ones that have zippers, and there's different strengths. The strengths can range from low, moderate to high, and that obviously would be a decision made by your physician and also based on the results of the sonography exam that you had.
All right, but they really do work. I've seen a lot.
They really do work.
My stepfather wears them.
Now, I talked about earlier today that the veins are divided into two groups: deep veins and superficial veins. The superficial veins are the ones that have the problem. That's where, because they run into the fat, and the fat doesn't supply any support. The muscles supply support for the deep veins, so they rarely fail. Now, what the stockings do is the stockings mimic the support that the muscles give the deep veins, but to the superficial veins, if that makes any sense.
No, it does make sense. Now, I understand there are quite a few factors in determining treatments for venous insufficiency.
Correct.
A few of them would be the symptoms.
Symptoms, age, severity of the condition, and exactly location of the condition as well, and the toleration of the medication and procedures. Now, back in the day, we used to offer what was called vein stripping. That's where we would actually physically remove the vein. And
right,
I think I talked about that
a little
earlier.
bit.
Now we offer different endovenous, minimally invasive procedures. These are office-based procedures that are actually ambulatory, and the patient can have them done the same day and leave. In some cases, can return back to work. Very well tolerated.
What is that procedure?
These procedures range. So they typically can range from foam ablation to radiofrequency ablation to even a newer method where we actually close the vein with a glue.
Glue?
A glue.
Elmer's glue?
It's not quite Elmer's glue, but it's a derivative of glue.
And you literally just seal it?
I literally glue the vein shut.
Oh my gosh, and that just obviously stops it?
It seals the vein.
Shuts it down.
It shuts it down.
Is that safe?
It is safe.
Oh.
It is safe. We've been performing this procedure for the past 2 years. It's been approved by FDA for the past 2 years.
All right, so lots of treatments. What about medications? What are normal ones?
Correct.
We talked a couple of that.
So typically when I see a patient in my office, I counsel them on good vein health. First and foremost, use of compression stockings. This is a daily requirement. Think about it a 9 to 5. You wear them, put them on in the morning, you take them off in the afternoon. Elevating the legs. Cardiovascular exercise. 30 minutes every day, consistent.
7 days a week?
7 days a week. And I'm not talking about, this is different from your exercise to increase your heart rate for endurance. This is just about going for a nice leisurely walk.
I see.
All right, just getting those muscles moving, getting that blood up back to your heart.
How important is that? Because some people just say, oh, please, but it's important.
It is extremely important. Now, the problem is that we're seeing a lot more of this now that our society is more sedentary.
Right, the sitting is the new smoking, I hear.
Correct. And we want our patients to get up and get out there and go for a nice leisurely walk and get moving. That is good vein health. Additionally, you need to keep yourself hydrated. Dehydration is a big factor. You need to drink adequate amount of water. Usually 1 ounce per kilogram body weight is the recommendation. And obviously eating healthy and watching what you eat and so forth.
Okay, break it down easier for us in terms of that 1 ounce per kilogram. How many glasses of water a day?
So typically for, let's say, a 70 kilogram, let's say a normal 160 pound person, that would probably be around 70 to 80.
There you go. Okay. And when would surgery be necessary for venous insufficiency?
Now, surgery can be a personal decision. It can be a medical necessity. Now, typically in my patients who present when they already have skin damage or an ulcer, then I obviously prompt them and I recommend the procedure. Now, I have some patients that come in and with varicose veins, and we always do a trial of stockings first, but if they fail those stockings, they don't like those stockings, or they'd like to possibly prevent the complications that can come in the future, then I sit down and we have a real conversation and we discuss the procedure, whether or not they would be a candidate and whether or not they'd like to proceed with the procedure.
All right, fantastic. We're going to take a quick break, and when we come back, we've already talked about some methods of prevention. We're going to talk about a few more when we come back. We're also going to talk about healthy lifestyle choices and prevention when we return. So lots more to cover in just about the 15 minutes we have left in the show. You're watching the Health Channel, all health all the time on South Florida PBS. If you have a question for the doctor, please call us using the toll-free number 855-796-4475. Please be sure to visit our website, allhealthtv.com. You can watch a live stream of the Health Channel, and you can watch videos from previous episodes. We are back in about 2 minutes. Stay tuned.
In the past 50 years, we've made a lot of progress in smoking prevention. But if we don't do more, 1 out of every 13 children alive today will die early from smoking. That's 5.6 million precious lives we can save. Together, we can make the next generation tobacco-free.
CAR T-cell therapy is a revolutionary new treatment for cancer. Healthcare companies developing CAR T immunotherapy use Thermo Fisher's Dynabeads technology to isolate, activate, and expand T cells that have been genetically engineered to recognize and fight cancer cells.
We're taking the patient's own cells and enriching those cells to fight the cancer.
For more, go to thermofisher.com/CTS.
You can try to ignore it, but the problem is everywhere. Every instinct says don't look, but sooner or later we must, and our reaction is only natural. Mice contaminate food and transmit disease. Termites cost billions of dollars in property damage each year. And cockroaches can trigger asthma attacks and spread salmonella. Trust your instincts. Learn more about how to protect your family at pestworld.org.
Dear humans, I stand here today not for myself, but for every tail wagger, sloppy kisser, and curtain ninja. I stand here for each one of the nearly 4,100 dogs and cats killed in shelters each day, asking you to join our cause and help us make sure every best friend has a chance to meet one of their own. With Best Friends Animal Society leading the charge and your help, we can save them all.
We develop quality citizens who keep our core, our country, and our communities side by side on the winning side. Not for glory, but for honor. For a code that isn't written or spoken, but lived. It's what we do. It's who we are. It's the battle cry of our fighting spirit. Battles won. See all the battles Marines fight to win at Marines.com.
SCAD stands for spontaneous coronary artery dissection, and it means there's a tearing in the walls of the arteries that bring blood to the heart muscle. In recent studies, it seems to affect more than 90% women compared to men. It's a disease that is not well known, but the causes can include certain types of artery problems such as fibromuscular dysplasia and other connective tissue disorders, as well as being peri or postpartum, and then other things such as emotional stress or extreme physical exertion. The main signs and symptoms are presenting with a heart attack, and those signs are chest pain, trouble breathing, any type of discomfort in the chest. People may feel lightheaded or dizzy or sweaty. And if you happen to have a predisposing disease of the blood vessels, then definitely have a low threshold to getting help.
Welcome back to the Health Channel, All Health, All the Time. I'm Olga Villaverde, and with us is Dr. Edgar Galinanes, vascular and general surgeon at Miami Cardiac and Vascular Institute. If you have a question for the doctor, please call us using the toll-free number 855-796-4475. We would love to hear from you. So, we've covered a lot of ground this hour in talking about venous disorders, but as we wrap up the show, I think it's important to note that while there's really no way to completely prevent some of these venous disorders from occurring, there are certain measures we can take to stop its progression. Is that right?
That's correct.
So what can we do to help this out?
So again, good vein health, wearing your stockings, keeping yourself adequately hydrated, cardiovascular exercise every day, eating healthy, trying to avoid foods such as sodas and unhealthy foods from fast foods and so forth that may have lots of chemicals that actually can cause venous dilatation.
So out of 10 patients that come into your office, are you surprised, because you were talking to me about this in the break, that they don't drink water?
That's correct.
Really?
I'm very surprised. I'm very surprised. I would tell you that the number one thing I hear from all my patients is, doctor, after I met you, I drink so much more water.
Oh, that's fantastic.
And they feel better. Patients feel better.
All right, and do they improve their lifestyle changes as well?
Yes, I have many patients that I've seen that I've just managed with lifestyle changes, and obviously there's some patients that actually have some more symptoms despite using the use of the stockings, and I can recommend some herbal or organic medications over the counter, such as horse chestnut extract or some other medications.
So even though we can't prevent this, obviously these little changes can make a big difference?
It's a big difference. I have many patients where I work with them and I see them on a regular basis, and we work on lifestyle changes and even weight loss on some of the patients who are obese, and little by little they start feeling better.
All right, so let's recap a little bit and take a look at some of the best ways to keep our blood flowing, which is what we want. Doctor, let's go through these. Keep legs elevated.
Absolutely. At the end of the day, those legs should be up.
Wear compression stockings.
Yes.
Keep legs uncrossed when seated.
That's true.
We've been taught to cross our legs.
That's true. So one of the things that we do tell you is to uncross those legs. Unfortunately, crossing the legs puts a lot more pressure on these veins, almost like twisting the garden hose.
All right, so I just literally
yes, uncrossed
my legs. All right, exercise regularly.
And exercise regularly. And remember that we're not talking about anything strenuous. I don't want you to compete in a marathon. Just going outside for a nice leisurely walk.
I've heard to eating high fiber and low salt can help. Is this true?
Absolutely. Diets in high salt can lead to water retention. Water retention can obviously cause vein dilatation. Fiber is also another method to help low fiber diets also cause you to retain water, which causes venous dilatation.
My producer told me at least to
Huh?
cross my ankles, and I literally just did that under the table. I crossed my ankles to look more proper now. What about heels? I hear high heels. Look at mine. Is this bad? Oh my God, I can't believe I'm doing this. Okay, look, are they bad?
No, you know, most patients come up to me and ask me, hey, could I wear heels and so forth.
Those are really high.
Those are high. Those are high. I commend you for using those high heels.
Well, because I'm such a short woman, so I need to wear high heels.
So
heels are okay?
Heels are okay. Heels are okay, as long as you're doing it with your stockings.
Stockings? Who wears stockings anymore?
So
pantyhose are good?
Pantyhose are just fine, and you know, there's lots of variations. I have lots of patients who come in and tell me, I don't want to use, you know, doc, I'm a young person, I don't want to use these stockings. My grandfather used these stockings. Or I have patients who are athletes who come in and see me, and we actually switch them to compression gear. These compression garments are actually utilized by athletes all over the world. I don't know if you watched the Heat play the other day. You know, you see Dwayne Wade with these compression stockings.
Yes, I always see.
Or you see Kevin Durant. The guy's 7 foot and he has stockings all the way down to his ankle.
Mm-hmm.
And those are compression stockings to help the circulation. So it's not just for your grandfather anymore. And I have lots of patients who use these sport athletic garments.
I see them on the arms too.
Correct.
For some of the football players as well.
That can also be for muscle recovery.
Muscle recovery. So I should maybe bring back hosiery in my house, pantyhose?
Well, the right types.
All right. What is a couple more things? We're wrapping up our show. I hear the word restless leg syndrome. What's that?
So restless leg syndrome is a syndrome where you have the inability to stop moving your legs. So typically, the one who complains about it mostly is your partner who sleeps with you in your bed. They usually tell you to stop moving your legs. Patients who have venous insufficiency and have that blood pooling in their legs typically have this need kind of to move their legs. Lots of times I have patients that come into my office and tell me I have these kind of like ant-like symptoms in my calves at night that just I need to move my legs. And restless leg can be a symptom of venous insufficiency.
Magnesium, is that good for that?
Magnesium is very good for that.
Okay. Is magnesium just good as a whole? I've heard lately that it's a good, supplement.
Magnesium is found in green foods. Unfortunately, in our society, we no longer eat green foods, so lots of
So we're not drinking water, we're not eating green foods.
Yes, so I focus a lot on my patient's diet, and yes, I do recommend either a dietary supplementation of magnesium, or you can just eat your veggies.
What about magnesium oil that I heard you could put on your legs sometimes?
You can use that. I actually recommend my patients use arnica.
Arnica.
Arnica is a plant. It's a plant-based cream. Think about it like anti-inflammatory. It's very good for these venous type of pains.
All right. Okay. We are nearing the end of the show. Any last-minute thoughts for our patients, our viewers out there?
I hope you were able to take away from this whether or not you yourself need to look at yourself and decide whether I need to get out, walk more, drink more water. If you feel that you're suffering from veins and this is really affecting your lifestyle, in the case that you're more tired, or even if you do have these horrible varicose veins and they're causing your pain and aches, or if you have a wound, please feel free to give me a call and I'd be happy to see you and help you.
And you have a lot of patient stories where you explain to us where they changed their lifestyle and they started drinking more water and things get better if things are done correctly.
Correct.
Can you think of one that really just was a remarkable change that they said, Doctor, thank you so much?
I do. I had a gentleman who, he was in his 60s and he lived by himself. He wasn't married, he didn't have a family. And he'd come to see me with wounds in his legs. And I'd put him in stockings and I'd wrap him and I'd get his wounds healed. And finally one day I was like, what's going on? Why do you keep on seeing me? We do this every 3-6 months. And he's like, Doc, I live by myself. And I'm like, how's your diet? And he's like, I eat horrible. I eat out every day. And he doesn't know how to cook for himself. So I actually gave him a recommendation that I used to do when I was in residency and I didn't have much time. I used to eat healthy choice meals.
Oh yeah.
And they're not bad. They're cheap. They're cheap and they're good.
And they're easy.
They're easy.
Yeah.
So he started doing this. He lost over 40 pounds, and I have not had to wrap his leg for a venous ulcer in over a year.
You're so good. High five.
So I'm very happy.
That's great. All right. I know you're going to surgery now?
Yes, I have a case.
What's the case?
The case is a gentleman who has a history of smoking, is diabetic, and has some blockages in his arteries, and he's at risk of losing his legs. So I have to help him.
You have to help him a lot.
Hopefully we'll keep his leg.
What do you expect after this surgery? I know you still haven't done it, but what are your thoughts?
Oh, no, we'll be able to help us.
Oh, you will?
Absolutely.
Oh, that must be a great feeling.
I love helping my patients. So it's why I get up in the morning.
You love what you do?
I do.
Well, we love having you. I know it's our first time together. I hope you come back again.
Absolutely. Thank you very much for having me.
Nah, thanks for being here. Thank you, Doctor.
Thank you.
God bless you for what you do. Appreciate it. And oh, wait. We have to do what you suggested to everybody. Drink your water. Go
ahead.
Yes. What was it again? What was the formula?
1 ounce per kilogram body weight. So essentially, it's two bottles of Smart Water.
2 bottles of Smart Water. How many ounces?
Approximately 60 ounces a day.
Mine has vodka in it. I just didn't want you to know that.
That's fine.
I'm just kidding. It's water. Thank you, Doctor.
No
That's
problem.
all the time we have for today. Thanks for watching the Health Channel. All health, all the time. I promise you it's water. On South Florida PBS, follow us on Facebook and Twitter at All Health TV, and be sure to visit our website, allhealthtv.com, where you can watch a live stream of the Health Channel and watch videos from previous episodes. I don't even drink, for that matter. I'm Olga Villaverde. We'll see you next time. Have a great day.